420. And we are going to be talking, you know what? This is the day that some have been waiting for. We're going to be talking with Dr. Allison Rodgers from the Fertility Centers of Illinois about the impact of marijuana, also known as ganja or weed. And I know there are a lot of other names, THC, and other products on fertility and fertility treatment. So thank you, Dr. Rodgers, for being here.
Thank you so much for having me.
Awesome. So first, tell me a little bit about how you came to be somewhat of an expert in this topic. Was it that you had patients who wanted to know, can I continue to smoke weed while I'm trying to get fertility treatment? Or
Yeah, so in Illinois, like many other states in the country, marijuana is now legal, both for medicinal reasons and recreational. And there are, a lot of patients and their partners who use marijuana both before and after it was legal. And it's, we as fertility doctors educate our patients on all kinds of things that will help them conceive, whether it's, diet, exercising, medications that they're taking that for something that may be interfering, and other lifestyle choices that it's important for fertility doctors and all doctors really to educate their patients about what's going to help them achieve their goals and what might be in their way.
Okay, that's great. So again, for those of you who are just joining in on Facebook and Instagram, we've got Dr. Allison Rodgers from the Fertility Centers of Illinois. And our topic today is fact versus fiction, CBD, THC, and good old-fashioned marijuana and your fertility. So thank you so much, Dr. Rodgers. She shared a little bit about why she cares about this topic, because it's important to her patients. And just like in many other states, in Illinois, marijuana is legal to use both recreationally and medicinally. So can you talk a little bit about the difference between the difference between marijuana, just smoking the plant, versus taking CBD, which is, I think, one of the byproducts of breaking down the plant, or even THC. Can you talk a little bit about that?
Yeah, so this is a really common thing where a lot of times people are using these terms interchangeably, but they're really not. So marijuana is the plant, as you said. A lot of times it's smoked or put into edible options, and the sort of chemical that causes the high that people enjoy is THC. And THC is what really is the chemical component to the marijuana. And the THC can be used in gummies and other edible forms, and it doesn't always need to be smoked. CBD is a chemical component of the marijuana that causes a lot of medicinal properties. And I think this is a topic where a lot of research has not been done yet, but it does not cause the high. And so this is a supplement that can be used, not regulated by the FDA because it's a supplement, and it does not cause the high. So when you think about CBD oil and CBD whatever lotion, and that is to help with sort of pain management and some other things that people think it may help with, nausea, other things, but it will not cause the high that THC and marijuana. So that's the difference. CBD does not cause intoxication.
And so are there differences in the way the body reacts to CBD versus THC versus just smoking the plant? And are any of those either in isolation or, multiple, are they good for you? Are they helpful for fertility, or are they harmful for fertility? Or
so I think, yeah, so I'll speak first to the CBD. First of all, CBD in general can be helpful for patients who have joint pain, nausea, that kind of thing. From a fertility perspective, there's really no effective studies showing that the CBD is something that can benefit fertility. When we think about marijuana and smoking, I will just say smoking anything at all, inhaling smoke into your lungs will cause cancer at some point because of the carcinogens that are burning. So I don't recommend anyone ever smoke anything. So, THC, which is the chemical component that causes the high, it can be found in edible forms. Now, when you smoke something, it gets to your lungs, and there's a lot of blood vessels in our lungs. And so people can feel that high very quickly, just like, smoking anything or inhaling anything. It gets to your bloodstream very, very quickly. When we think about the edible forms, like a gummy, for example, you're consuming it. It then has to get broken down by your stomach and digested. And instead of a few seconds to a few minutes of being able to feel it, we are not able to feel it for a few hours sometimes. And this is important to know because sometimes people actually overdose because they take a gummy, they wait 30 minutes, they don't feel anything, they take another one, they wait 30 minutes. It can often take about 2 hours to feel the effects of it. And so it's just important to know that. From a fertility perspective, it's a little bit controversial in men about marijuana and fertility.
Okay.
So there was original studies showing that marijuana binded to estrogen receptors and that it actually reduced sperm counts in men. There was a study in mice showing that mice, who obviously are very fertile, had a 30% decrease in sperm after being exposed to high levels of marijuana, and that the function of the sperm, so morphology and the ability of the sperm to be able to get into the egg, was significantly reduced. Some more recent studies in humans have shown that sort of moderate use maybe does not cause the effects that we've seen. I will tell you from a personal perspective, I have had patients who say they smoke like an absurd amount, high amount, and they seem to have normal sperm. And I also have patients who smoke very rarely, once a week, whatever it is. I guess that's not real rarely, but very minimal amount and have very hugely affected sperm. So I think that it's really controversial about the role of marijuana in sperm. And I think that, more studies are going to be really needed to know whether it's something that causes problems or not, and it very well be that in one person it may cause a problem and another doesn't seem to. So I certainly don't recommend marijuana for either men or women while they're trying to get pregnant. From the THC and marijuana perspective, once you are pregnant,
Yes.
um, the American College of OBGYN did put out a bulletin recently showing that marijuana can and THC products affect fetal brain development.
Ah,
And it also creates smaller babies, similar to smoking cigarettes. Okay. And, you know, when I was delivering babies, I don't do that anymore. I just get people pregnant these days. But when I was delivering babies, I had a lot of patients who were smokers. And when we would deliver the placentas of these babies, of people who smoke cigarettes, the placentas were all scarred. The vasculature looked very, very abnormal. And, you know, we don't know. And I don't think there's been any studies about smoking marijuana at high amounts, and placentas, uh, how they look under the microscope. But I will tell you, it affects fetal brain development,
mhm.
and it also creates smaller babies. Obviously, every woman who's pregnant, and I would imagine most of the women who are watching this are trying to become pregnant and struggling to get pregnant, right?
Yeah.
We want to do absolutely everything to have the safest, healthiest baby possible. And because of that, obviously, I would recommend that while pregnant, not having any use of, marijuana, THC, or CBD once pregnant for sure. And, I struggle with patients sometimes who are prescribed medicinal marijuana from other doctors for medicinal reasons, pain control, and that can be really a struggle because, for example, I have a patient whose husband was in a car accident and he's on THC instead of opioids, right? So trying to figure that out, I think sometimes it needs to be an individual doctor patient collaboration with all the doctors involved. But for the most part, I think that staying away from any chemicals that can affect, pregnancy or fertility is always a good thing.
So, wow, that was a lot of really good information, and that's important. So for everybody who is out here celebrating 420, it seems like what Dr. Rodgers is saying is put it down, put it all down while you
Well,
are.
so the other hard part and the interesting thing is that when women are sort of developing their eggs, obviously we're born with all the eggs we're ever going to have. And as we go through life, we, lose our eggs, right? So, there is a little bit of a life cycle of about 3 months where eggs are sort of growing from the time they sort of start getting more mature to the time they ovulate. And that's an important time for 3 months sort of to have, as little toxins in our body as possible. For men, it's around 10 weeks. It takes sperm 70 days to be produced. Now, men, they just keep making sperm and making sperm. But anything a man does for 10 weeks can affect, sperm function and everything that we, see in terms of the count, the quality.
So 10 weeks. Anything you do today will impact you and your potential embryo in June. That's pretty hard for many people to kind of, that's a concept that I don't think many people think about.
Right. And the other thing I would say is that I think, especially while a lot of us are here sort of sheltering in place and quarantine to our homes, I think a lot of and maybe not able to do the fertility treatment they were hoping to do, a lot of my patients certainly have reported they've turned more to marijuana and alcohol and other sort of toxins that, I would encourage anybody trying for a baby to really utilize this time to see what you can do to improve your health and not be in this sort of like, woe is me, I can't do it, I'm just going to do whatever the heck I want.
Right.
And to really focus on what their goals are so that the minute they're able to do treatment again, that their body is as ready as possible to be the best success as possible.
So that's interesting that you say you've got patients that have kind of started to drink more and smoke more. What I've heard from a lot of people is because of the limits on leaving the house, whether it's they couldn't, catch up with the person that they usually got marijuana from, or I know that the liquor stores are doing great brisk business right now, but some of them don't deliver, and everybody's not comfortable being out on the roads right now, but I live in Maryland, which is a state where it's not legal to, okay, Reverend Joan Wharton said, amen, put it down. Thank you. So, I live in a state where it's not legal to smoke marijuana, but we do have many clinics that have been set up specifically to provide people with THC or CBD or just the other products. Now, there are many who are part of that community who believe in the medical benefits of CBD because you don't get the buzz, but I have anecdotally heard stories from people who said, this helped a lot with this condition where there was inflammation, or it helped with this condition where there was a chemical imbalance. And you have not found that to be true, or you found it to be kind of inconsistent.
So I will say, if you go right now and Google CBD and fertility,
yeah,
there are certainly people selling CBD who are touting that it will help your fertility. That maybe marijuana won't, but CBD will.
Yeah.
And I will tell you, I went because I Googled it myself and was looking when I was preparing, to know more about this topic. And I will tell you, if you actually go to the scientific literature, which is where we get our science and we practice evidence-based medicine, there has not been any studies in humans or animals with CBD improving fertility. Now, might it help with joint pain? Might it help with potential, it doesn't cause the high. So it's not going to cause, CBD is not going to cause that relaxation and other things. Might
Right.
it help with anxiety? Potentially. Is that going to help your fertility? Probably not.
And that,
So, I certainly think that anxiety and stress management is so important for patients going through fertility treatment. But there are certainly some really healthy ways to do that. So there's been some good studies showing that acupuncture and yoga can help tremendously with stress management during fertility treatment. And those obviously are healthy ways to sort of promote fertility without putting, additional potential toxins in your body.
So find another way to relax.
I
Um,
think so, yes.
yeah. So guys, if you have questions or you want to share your thoughts with Dr. Rodgers and with myself, please write it right there on Instagram and on Facebook, and we'll respond directly right while we're speaking. And if it comes in after the fact, I'll make sure that Dr. Rodgers gets the question. But we want to know what your thoughts are, what your experiences are. So let us know. What do you think about CBD, THC, marijuana, and fertility? Dr. Rodgers has already stated that the data really don't support using it, and the data that exists would suggest that smoking marijuana is bad, smoking anything is bad, and that the CBD may impact sperm quality. Did I sum it up correctly? Great. So I'm going to continue, but please feel free to send in your comments and questions. So do you all have any programs at your clinic that help patients? Because this is not something that is this is something that could potentially be detrimental to their goal to have a child or have children. Are there any, what do you do when you have patients that come in? Do you counsel them to just stop? Do you how do you go about that?
Well, and I think that, marijuana is one thing, certainly. I think most patients who are using marijuana are either using it recreationally or they're using it under the guidance of a doctor. I think one of the other things besides marijuana that's as big of a problem that's maybe even harder to stop is nicotine. And I stopped asking patients if they smoke. Number one, because people are saying, smoke what? And number two, because a lot of patients are using nicotine in other ways. They're chewing nicotine, they're using vaping,
Yeah.
and there's other things. So people say, no, I don't smoke, but oh yeah, I use nicotine. So I think, like with any other lifestyle choice, whether it's drinking too much alcohol, whether it's you know, doing any other activities that may be detrimental to fertility, I always counsel patients about my recommendation. And yes, I recommend that, because there is that 12 weeks, 10 to 12 weeks for men and 3 months for women. So about 3 months for everybody. That, when patients come to see me, that's one thing that they can do. So much of the fertility process is out of our control, right? We can't control how many eggs we have, we can't control what our uterus is like, we can't control if our tubes are open, but what we can control are some lifestyle things, and it's one of the very few things that you actually have control over. And so I definitely encourage my patients for smoking or marijuana cessation, complete stopping of it. And we have at our facility some psychologists who work with our team and our patients that can always talk to patients about all different kinds of things. They're obviously not addiction psychiatrists or anything, psychologists or anything like that, but I certainly have had patients who I've recommended that they see a psychiatrist or psychologist before being able to move forward with treatment. But obviously that's only patients who have a very big problem with substance abuse and not able to control it.
Yeah.
But I think that, there's just not enough studies showing it's safe. And the few studies we have, especially in early pregnancy, showing that it can be really, really harmful.
So that's all really good information. And so, a lot of times people get their information, even medical information, from Dr. Google. They just look it up. And Google didn't go to medical school, but he knows a lot, or she knows a lot. Some of the things that she or he will tell you are incorrect. So make sure that you talk to your doctor about this before you
Yeah.
decide, I saw this study on Google or I saw this ad company and I'm going to move forward with it. Because your doctor will be able to explain to you, just like Dr. Rodgers did today, and give you the actual the data, the references, places where you can go to get more information. But for people who say, uh, well, how can I get involved with clinical studies? Do you know anything about clinical trials or where people may be able to get information about these types of, if there's anyone who's even looking at this, where would they find out about that?
Yeah, so I think that the CDC tracks every clinical trial going on right now. You always can check with the CDC. I'm not aware of any studies looking at pregnancy and fertility with these studies, and I also think that most times, we're not studying pregnant women and drugs to see if it's safe or not. We're just, nobody wants to sign up for that trial. More of it is sort of retrospective, patients who had a problem, had a baby with a problem, and then they go back and do retrospective data as opposed to prospective data. But, this few studies that have been done, as the American College of OBGYN bulletin says, is just that it can have a big effect on fetal development. And, I do have patients say, well, can I just stop once I get pregnant? And, the truth is that by the time that you have your first pregnancy test and you find out that you're pregnant, you ovulated 2 weeks before that. So that is, and as the pregnancy is establishing itself, the blood flow to the uterus is really important, and smoking anything can affect uterine blood flow.
So if you're going to spend the time and the emotional effort and the money to go through fertility treatment, which is not cheap, then you need to do everything possible to increase the likelihood of a pregnancy and bringing home a healthy baby. So
that would be my recommendation. And I think that, certainly some patients are not necessarily ready to sort of give up that lifestyle. Also, I have a lot of women who struggle because they can only control themselves and they cannot control their partners. And their partners participate in all kinds of activities. Marijuana being one of them, that they might be impacting their fertility, but they don't have control over their partner. And that is always really challenging for women who are wanting to do the right thing, but they can't convince their partner to do the right thing.
So do you all ever reject a patient because either they or the partner is unwilling to abstain from activity that
Would have to be something really serious. So not at this time, but I will tell you, for example, Blue Cross Blue Shield of Massachusetts right now is screening patients, both husband and wife, for codeine before they will allow them to pay for fertility treatment. So and I feel like they are probably the first of many. If you are in a mandated state where you have fertility coverage, I mean, I'm in a mandated state and Illinois is not doing this right now, but I certainly have patients who have Blue Cross Blue Shield of Massachusetts, and every single patient has to do codeine and have it negative, and their partner. So I have a patient who was, in the fall rejected from IVF. Her insurance would not cover IVF because she had positive codeine in her system. And so, or she did not.
well, for
And
those
so,
who are wondering, can you tell what cocaine is?
yeah, so codeine is a breakdown byproduct of nicotine. And so that is the way, if people or insurance companies or, whatever, are trying to figure out if you smoke, employers, that you can have a blood test done for to see if there's any codeine in your system. And I don't remember exactly how long it takes to get out of your system. I know for sure at a month it should be out of your system. But luckily, my patient's partner, it was the thing that sort of gave him the kick in the bottom to, to quit smoking. And he quit smoking, and they were able to move on with fertility treatment. But it was certainly a delay to their care. And I think that it's probably just the beginning of a lot more of that. Now, if patients are, in a place where marijuana is legal, it's hard for them, I guess, nicotine's legal too. So we'll have to sort of see where this goes in terms of insurance coverage and all that stuff. It's really interesting to sort of see where it's going to go.
I think that private industry can make decisions about who they treat. I know that there are many clinics that don't treat patients who have certain biological issues, not biological issues, but if their BMI is over, for instance, a certain number, if they're over a certain age or under a certain age, there are decisions made about the likelihood of this procedure being successful, and therefore,
Yeah, and what we know about, and obviously a lot of those decisions are made for the safety of patients,
certainly,
and also for their for their success and ethical concerns too.
yeah,
So I think that there's a lot of certainly rules. I'm sure pretty much probably every clinic out there has some age rules and some, BMI rules and some health rules. And I think it's different if you are undergoing treatment where you're having to sort of go asleep, need anesthesia. Obviously, our patients who smoke have a much harder time with anesthesia, as well as the fact that there's an increase. There's an increase in miscarriages with smoking, right? So smoking both THC and with nicotine. And I will tell you personally, I had a patient who was smoking and she had 2 biochemical pregnancies in a row. And I was like, you really, really need to stop. And as soon as she stopped, the next transfer was successful. Was it only that? It's hard to know for sure,
okay,
right? It's a one anecdote.
right,
But, and it's hard to know exactly how long it takes to get out of your system. But, the more you can do to help yourself be healthy, the better.
yes, and I think that's a good place to bookend this conversation. Thank you so much, Dr. Rodgers. Again, Dr. Allison Rodgers from the Fertility Centers of Illinois, talking
Thank you
about.
so much for having me.
Oh, absolutely. And if you want to reach her, if you want to set up an appointment, or if you want to just follow her on social media, I think that she does have a Facebook and an Instagram page. Is that correct, Dr. Rodgers?
Yeah, so you can, if you want to set up an appointment, we're doing virtual consults. It's fcionline.com, and it will link you to our website where you can set up a virtual consult or in-person consult if you'd like. Also, my Instagram and TikTok, if you're doing TikTok these days, is at dr for Dr. Allison, ALLISON .Rodgers. And then Facebook, it's just Dr. Allison Rodgers.
Awesome. Thank you so much, Dr. Rodgers. And shameless plug for those who may have a financial need. Cade Foundation does offer a community building grant that would provide up to $10,000 for fertility treatment or adoption. And today, we've awarded 121 over $950,000 worth of financial support for family building. So
that is amazing.
Thank you. So if you're watching this and you have financial need, please reach out to us, cadefoundation.org/grants for more information. Dr. Rodgers will go on. I'm going to turn off social media, but thank you guys for coming in. We'll see you next time where we have Reverend Beverly and Skip Little from First Baptist Church of Glenarden. They're going to talk about how to stay intimate and connected while you are living with infertility. I can't wait. Thank you so much.
I got